This discussion is about the dangers of overhead pressing when it comes to the development of symptoms of thoracic outlet syndrome that will occur up through the top of the chest and the front of the neck, and it can send tingling down through well, there can be pain, but there can also be, tingling sensations, numbness now down through the arms because of this thoracic outlet syndrome. And the conversation is with a doctor, a radiologist who examines and reads x-rays and all types of imaging of thoracic rib cages all day long. That's her profession. She's a medical doctor from Canada. She's an online client who came to visit me in New Jersey, and we have a lot of commonalities, and so we decided to do a little short talk about thoracic outlet syndrome and how that relates to overhead pressing.
I'm a thoracic radiologist.
Okay, so you look at thoracic areas a lot.
Every day, yes.
And there's a lot of important stuff that goes through that thoracic area, correct?
I would say so.
Could you name some of those
I would
things?
say so, yes. I mean,
Because what I'm getting at
lungs,
is if a thoracic area can't alternate pressure gradients because it can't rotate, period. We know the spine is not
right.
We know the spine is not rotating appropriately, which means the ribs cannot alternate their
Right.
cycles of compression and decompression. So some areas of the rib cage of the thoracic rib cage are going to get in a permanently compressed position, and some are going to be in a more open position, which is postural respiration, right?
Exactly.
I don't think people, and I certainly didn't either. I thought when I was first starting, I was thinking way more about the pelvis and from, to be honest, a more biomechanical standpoint. But then once I made that switch, which didn't take too long because of my own personal experiences, I realized, wow, if this thing is not rotating and compressing and decompressing, and then I saw all the important stuff that goes through there, like, you're going to be in trouble. So I realized that this area is of supreme importance, and you are an expert on that area. So just tell us, what are some important things that you will find in this area? Organs, nerves, even your vestibular system reaches down into that thoracic trunk.
I mean, yes. So, I mean, you do have both of your lungs, you have your mediastinal structures, which contain your heart and your great vessels. You have your diaphragm,
Yeah.
which is
Plural.
utmost importance in PRI, your two hemidiaphragms. And you have a lot of nerves that innervate, including the vagus nerve. You have a lot of lymph nodes that are also within the mediastinal structures, which are normal in a lot of people if they're not enlarged.
Mhm.
But yeah, and then you have your bony structures and your muscular structures, which are, huge components into the mobility of your thoracic rib cage, and that includes your ribs, your sternum, your spine,
Yeah.
and all of the adjacent muscular structures.
So I'm always, because a lot of people have thoracic outlet syndrome.
Correct.
You have a lot of nerves that, if I remember correctly, they're coming off of the cervical neck area.
The brachial plexus. Yes.
That
Yes.
flow through this area, at least to some degree.
Yeah.
If there's over compression in these areas, could those nerves get, impinged?
Absolutely. And it's not uncommon to see that in people actually that weight lift, and you have the younger males that have a lot of muscular development in the upper thorax.
Yeah.
And it occurs mainly with overhead movements where you have shoulder press and whatnot, where you're compressing all those structures. And this anatomy here in the neck with the nerves is an incredibly tight anatomy, if you will.
Mm-hmm.
So applying any pressures on that can definitely cause symptoms of thoracic outlet obstruction.
Okay, and
absolutely, for sure.
Because a lot of people will say, well, I've been diagnosed with thoracic outlet syndrome, and a lot of times they'll have tingling down their hands and their arms, they'll feel numbness, things of that nature. And then there's also the neck pain. But so when you say it's tight, do you mean there's not a ton of space available for these structures?
Exactly. There's not a lot of space. There's a lot of anatomy going through a pretty confined space. There's not a lot of wiggle room.
Right.
In the neck.
So if you bring your arms up, you're making smaller space.
Correct.
Okay. Now, what if I were to leave one arm up and one arm down? Would that conceivably allow for more space because one side of your body is staying relatively open while the other side is actually doing a little bit more?
Absolutely, it would. It would definitely allow for more space in the neck, but I guess it would also depend on which side is symptomatic. You don't always necessarily have symptoms on both sides. You might have symptoms on one side.
The important thing is that if this area is not mobile and if it can't expand with air, that there's going to be tightness through the neck, the anterior neck, the posterior, I mean, pretty much anywhere in this area that
Yes.
will impact the ability for the scapulas to move without restriction, to move with the appropriate scapular muscles. A lot of people will start to
Correct.
overuse their SCMs, their scalenes, which are really important muscles when you see where the scalenes go. I think they're very underappreciated,
Yes,
but
I
man, they have an
agree.
impact on that rib cage and then also the scapular stability. I mean, because people they don't realize that when they're overhead pressing, they don't realize how much neck they are using and how much
Oh
forward
yeah.
posture they are causing.
Yeah, exactly. I think that's another thing that I really underestimated when I started PRI is the importance of breathing.
Yes.
You know, and again, I'm totally guilty of this. When I first started doing a lot of the exercises myself, I found myself holding my breath because
Yes. For
I was
stability.
muscling my way through them.
Mhm.
I was finding it incredibly challenging trying to put myself into positions where I was, struggling.
Yeah.
And then on top of that, you don't breathe and
You
you're
don't
just
breathe.
holding your breath.
Yes.
So, when you take the PRI courses and when you're, taught by people and, having the guidance people such as yourself to just breathe into that posterior mediastinum and feel it. It's
Yeah.
not
Feel it.
necessarily muscling your way, just
Feel it.
feeling it
Feel it. Yeah.
is huge and can really modify, how you feel of the exercise and how it's supposed to be.
And that is the biggest thing. A lot of people say, "Oh, I'm doing it," but unless someone feels it occur, they're not doing it. I know from
Correct.
experience, they're not doing it. And by posterior mediastinum, we're talking about the posterior area of the rib cage, which we
Correct.
on most people will be tight because of extension. They have to learn how to get into a state of flexion and open up that rib cage. But that left posterior mediastinum area, the left posterior rib cage, which is all important in the PRI hierarchy, cannot be felt very easily. That's why whenever I'm working with someone live, I'm
No.
putting my hand there. So they have some sensory reference. So they can feel the rib cage expand into my hand, or you put them against the wall, or you do something that they can feel their back move back. And even then, it's very difficult, especially if they're in a situation such as yours.
They're using your neck, yeah, or you're hyperextended all the time.
And I know people will say, well, how do I fix this? There is no one exercise. There is no one stretch or two or three, or even two or three PRI techniques that will take care of this issue for everybody because the origin of the issue can be different for everybody. And people have different levels of pelvic stability and different levels of ability to shift their body from side to side without compensation, different abilities to diaphragmatically breathe. And all of those things will influence what's going on up through the neck and the front of the chest where this thoracic outlet syndrome can take place. So the point is you have to get an individualized program after being evaluated by someone who knows what they're doing. And you can usually find those individuals on the Postural Restoration website. It's not something that you can just say, oh, hey, do these two exercises and you'll fix this. It doesn't work like that for anything. SI joints, back pain, knee pain, neck pain. It does not work like that. It never will because the origin of everyone's tension is slightly different.